Hey you, have you ever been prescribed a medication you wish you knew more about, you wish your doctor told you more about? This is a daily dose of mental health, and in this video, we're going to discuss Suboxone. And the reason why I want to talk about this is because this is a common medication that will be prescribed by doctors for patients wanting to get off of opiates or opioids. And I just want to start I'm going to start a new playlist, and this is still tied to mental health. And the playlist probably will be labeled information about this drug. It's going to be over medications and drugs that are commonly prescribed in the healthcare setting, that aren't discussed thoroughly or enough by the doctor. So you kind of have to do your own research on your own a lot of times to understand exactly what it does. And this is your daily dose of mental health. Once again, if you like this content, please subscribe to the channel. I'm not going to ask that throughout the video. Just if you like it, subscribe. And I've got a lot of different videos in regards to mental health, just generalized mental health, my own personal mental health and what my story is with drug addiction. And also, we're going to be discussing as well anxiety, depression, different mental health disorders, and also different psych medications as well, and what you want to know before starting to take them, because doctors a lot of times, once again, don't exactly explain the best sometimes. So the subscribe button should be right here in that right hand corner down there. So please subscribe. And before I go any further, I just need to go ahead and say out there, I am a healthcare provider. I am a psych nurse, RN. I am not a medical doctor. I'm going to try to make this to where I can't ever give medical advice, because once again, I'm not a doctor. However, I can direct you towards certain resources and information about medications, and I can give you facts about medications and things I've seen in my own personal experience from patients, side effects they've had, and the drugs I've taken. I can give my own personal testimony. But I'm not a medical doctor, and I cannot directly tell you that this medication or whatever medication will work for you. You will have to discuss that with your doctor. I'm just here to provide further information that needs to be discussed. All right, so let's go ahead and jump right into it. Today's medication will be Suboxone. This medication was approved by the FDA to treat opioid use disorder, and it was actually the first medication to treat opiate use disorder, and it was first started being dispensed in physician offices, and then further down the line, you started having things like methadone, Subutex, different versions of it. And one reason why Suboxone is sometimes the preferred opioid partial agonist to be prescribed is because it doesn't provide, compared to methadone, I'll just say this, it doesn't provide the same euphoric effects as methadone, and is actually safer than methadone. It's a lot harder, for example, if you're on heroin, for example, or you have opioid use disorder. So if you're taking things like, if you're addicted to hydrocodone, oxycodone, tramadol, Suboxone, if you go to a clinic or you're discussing with your doctor if it is right for you, that's typically the first controlled opioid they will prescribe you. Once again, it is what Suboxone is, it's a opioid partial agonist. So essentially, it will produce effects such as euphoria, and it can cause respiratory depression at low to moderate doses still. And I can't really get into the dosing. That's what you will discuss with your doctor. That's a question I would ask him is my dose high or low? And they should always start you on a low dose, but you should ask them about the dose ranges. When it is taken as prescribed, it is safe and effective. A lot of times, though, why it can be abused, and sometimes why they will move you off of Suboxone, it's because people who've had really hard past in regards to taking really high doses of even heroin and whatnot, they'll start you on Suboxone, see how it works for you, and if it's not working for you, you're not it's not helping with your withdrawals or anything, that's when they will possibly move you to a higher dose, because they'll always start you on a lower dose. But then if the higher dose doesn't work, they will move you to something like Suboxone. Really methadone. And that's what the methadone clinics are for. You go there every day. Suboxone, they typically, I don't know exactly where I live in my state, they typically give you a week to a week and a half supply at a time of Suboxone. While methadone, it's a daily clinic because of the doses and whatnot. And what I've personally seen with it, if you can make Suboxone work for you, that typically works a lot better, because the methadone clinics, you have to go there every day. And the harsh thing about it is at those clinics, a lot of times, you got to be really careful in leaving, because there are people there who will ask you for your medication and whatnot. It can be a nightmare there, honestly, sometimes. That's just I've never taken Suboxone or methadone. I've worked in clinics, though, and I've seen it firsthand. I'm not going to even deny it. That's why, in my opinion, Suboxone works a lot better, because you don't have to go every day, and if you can get a dose that works for you, typically patients have more success with it. And I can't tell you which one to take again. That's what your doctor's for. So another thing I want to go ahead and let everyone know about Suboxone, I'm just going to kind of be going over some facts that I've seen and jotted down, and this is directly from things I've pulled that I think is really essential for patients to know who have really either just started, meaning you just started the medication, a doctor thought this was the best thing for you. I'm going to read you some information about it that might not have been covered by the doctors and whatnot. So this is assuming you've already been prescribed, or if you just want information in general about it, it's stuff you could discuss with your doctor at your next appointment. A lot of this information I'm going to pull is from Substance Abuse and Mental Health Service. It's from the Substance Abuse and Mental Health Services Administration. I will try to leave the link for you guys down there, and I'm going to try to keep this pretty short and sweet once again. Okay, so really the three main things why they will give you Suboxone, as I already discussed, they like it over methadone because it's not as strong, and it typically does have, once again, it can have side effects long term, like anything you're on long term when getting it off, but it's typically easier to get off of than, per se, methadone. So here's some facts about it. So when your Suboxone is taken as prescribed, it is safe and effective, as I told you. It can lower the potential for misuse, and this is of other meds. It can help you just stay on that. Increase safety in cases of overdoses. So once again, you know the dose you're getting. It's not like using, in particular, heroin, where you could be using it forever. For a long time, and then you inject it or hit it one last time, and whatever you got from the streets this time could have been laced with fentanyl, and you're gone. So it's because of how they can control the doses, and really it can diminish the effects of physical dependency to opioids. And the main thing is it can really help with your with your withdrawal. So let's say you were abusing something like Oxycontin, Tramadol, heroin. It will really help you when you're going through that withdrawal process. But when you're withdrawing from that thing, when you're withdrawing from the substance you were abusing, it can really help with that. Now, this is what I find is the most important, and the main reason I'm doing this video, as I stated, is someone in the comments had a question about it. And thank you for commenting. If anyone else has medications they would like me to review for them, I will put videos out. I don't put names or anything. I don't say names or anything. But I like this because this is how we initiate interaction with our own mental health and whatnot. Because I will share my personal experiences on things I've tried, addictions I've had. This is not one of them, but I see this a lot. I've seen it a lot in the field of mental health. So this is what I find is very important. Okay, so I'm going to just read this. To begin treatment in OUD, opioid use disorder, a patient must abstain from using opioids for at least 12 to 24 hours and be in the early stages of opioid withdrawal. So one question that's commonly asked, so if you're interested in it and you're abusing a substance, if you're interested in using Suboxone, and let's say you're abusing heroin or once again hydrocodone, things like that, tramadol, they will ask you, and it is very important that for the first 12 to 24 hours, so let's say you're about ready to start your first dose of Suboxone, let's say you're going to start your first dose, you're going to go in at 12 tomorrow to take your first dose. And they should be discussing this, but sometimes, once again, I mean, with today's day and age, sometimes they don't go over this. It is critical that for at least the first 12 to 24 hours, so let's say you had your last dose of whatever it was, heroin, oxycodone, hydrocodone, it's critical that you go between the threshold of you abstaining from anything for 12 to 24 hours. And when you go in, they should be assessing you to make sure you're in the beginning stages of withdrawal. So that'd be like you'd be sweaty, anxious. They'd be looking for increased signs in heart rate to see that you're in it. And that's when they'll administer the first dose. Patients with opioids in their bloodstream or who are not in the early stages of withdrawal may experience this acute withdrawal. So that's the key. So let's say you tell your doctor you go in tomorrow, you're ready to take your first dose, but you have not, but you continue taking that other substance. Your other substance, tramadol, heroin, whatnot. What it's essentially saying is if you have not done this process of going through the beginning stages of withdrawal before you take it, so that first 12 to 24 hours with nothing in your system, and then taking Suboxone, if you've been taking something else with it, you can experience acute withdrawal. It's kind of like a rebound effect, to where if you're taking your Suboxone and whatnot, if you start Suboxone and you were still taking whatever the other substance was, it can have a rebound and you can have a acute withdrawal. And that can last upwards to a couple of days while you're taking your Suboxone. So let's once again I'll give an example. Let's say I go in tomorrow I'm going to take my first dose of Suboxone, and I told the doctor, yeah, I went cold turkey for 12 to 24 hours, don't have anything in my system, and they believe you. When you take your first dose, you'll take your dose of Suboxone, and then let's say your plan was, okay, I took my first dose, now I won't take the other substance. That rebound effect can cause you to feel very, 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 very nauseous, make you want to throw up. It can put you in a withdrawal, and that's a lot of times why people aren't successful at first when they take Suboxone, because they didn't actually go 12 to 24 hours with their other substance. And the reason with that being is Suboxone takes a while to start to build up in your system. So essentially, it takes a while, not as long as methadone. But once you are stabilized on the Suboxone, once you've stabilized on it, so like what I'm saying is the first week you can have some pretty bad acute withdrawals if you did not follow the protocol prior. And sometimes it's not your fault. Sometimes the doctors just don't tell you this. It's these little things that are crucial in my opinion. But once it can be anywhere from, depending on your metabolism, 3 to 5 days, but typically no more than like a week's the max. You should start stabling out. You should start stabling. And honestly, once you stable, sometimes they will raise your dose just a little bit more, and then you might not even have to take Suboxone every day. You might take it every other day. Because sometimes when they put you on a dose, the first couple of days you're like, oh, it's not working, I don't feel anything, and then they'll jump you up a dose, but you didn't give that your first dose when you went in, you didn't give it time to kick in. They'll put it up, and then you'll start seeing if you are on a higher dose, and you'll be assessed for it. I see all the time people who are put on a higher dose and they're nodding in and out. Like, it's literally like I've seen a patient in the chair at one of the clinics I've worked at, where he's like, oh, I need a higher dose, and I saw him the next week. They put him on a higher dose, and he'd been on Suboxone for a good 3 to 4 months. He'd been staying clean. What he said, and I always believe him. I will believe them until until we know otherwise. His drug tests were coming back clean. they raised his dose and he was nodding in and out. So I mean, just a couple milligram changes on these, you got to get you got to get that dose. And once you have that dose, they sometimes like to try every other day with it. Um, and keep in mind, an effective dose, you know it's working when obviously your cravings for whatever the past drug you were using should be going down. Um, and yes, you would say, oh, well, if the cravings are going down, you must be feeling some sort of euphoria on the Suboxone. Not necessarily. A lot of times, as you continue to take the medication, at first you can get some euphoria from it. That's just natural. It's a partial opioid. Um, but once your body starts acclimating, you should flatline, and you should just feel like you should start feeling more normal. That's why methadone they don't like to jump straight to, because it's a full opioid, and they are a lot more strong. And them being so strong, that's why they don't. That's why you typically have to go to the methadone clinic every day. During COVID, since I'm not working currently, I don't know if they make you go every day with it. But they're very skeptical about giving you that full dose. I mean, giving you more than at least a couple days at a time, because of the high it can give, and you could overdose on it. Suboxone lower doses, that's why they'll give you more, and they'll always start low. It's kind of start low and slow. So the first couple days, I mean, if you weren't told, or you decided, to take tramadol the morning of before taking your very first dose of Suboxone, that's what it can cause, that acute withdrawals with it. And that doesn't mean it's not working. It's competing with the other receptors in your brain, which can cause that rebound effect, and make you throw up, feel nauseous, you feel like crap. But it should balance out. Once again, average person, 3 to 5 days, no more than a week though. Once again, it says on here, before starting it, you should be talking to your doctor fully to understand the medication. Typically, what I've seen this, they'll just give you a packet and they expect you to go over it. I've even been in the healthcare setting before when I've been a patient in the past, and they're giving you all these instructions. A lot of times, a lot of people just don't read them, and that's the importance of reading it or watching something on it. So some common side effects, and this is either when you first start or when you continue, since it is an opioid, constipation is something that in particular at first you could experience things like the canal fecal impaction and whatnot. You want stool softeners, will really help with that. But once you get your dose once again stabilized, that should go down. Dizziness is common, drowsiness, sweating is can happen if can happen regardless, especially when you first start. Your body's balancing as well. Dry mouth as well is a big one. They're always drinking water, a lot of patients. But those are the common ones. Now, if you are having severe sleep as well, once again, a lot of these dictate, because everyone's body's different, but a lot of these dictate, did you go 12 to 24 hours without whatever you were abusing before starting Suboxone? Now, if you are suffering from things like, if you start the medication, you've done everything right in the beginning, disturbances in attention, that means you can't focus at all. You're having racing thoughts. You're seeing things, heart palpitations, tremors. Those can be some serious side effects from it. The biggest one, I will say, when it comes to serious, is respiratory distress. So if you start the medication, and when you're going to bed at night, if you have a significant other or you're married, you should have them really monitor your breathing rate. So if you go to bed before whoever, you should ask them. This is just something. I can't, once again, not medical advice, but one thing you should do is be like, hey, when you see if I'm asleep, can you just put your hand right here on my stomach, like right here? It's on my stomach, so everyone knows. And just have them count in 1 minute how many breaths you have, how many times you're breathing. And normal is anywhere from 12 to 20, 12 to 22, 12 to 24. But if you're in really good shape, it can be a little bit lower. But if it's at 8 or below, call your doctor and let them know what's going on, because they might have to adjust your dose. Some other safety precautions I want to go over real quick. Definitely, if you're pregnant, or you plan to become pregnant, talk to your doctor. Um, Definitely, you want to prevent children and pets not to be around it. Make sure you definitely keep it stored away in a dark space, like in a dark space. You don't want it to be exposed to sunlight. So, with the medication, if you have a mirror on your wall, keep it in there, keep it in a drawer, keep it away from anyone, because if somebody takes it by mistake, that can have some serious problems. Um, there is still a misuse potential on it. It is a partial opioid. Um, and one last thing that's really important as well um, is if it is not working for you, talk to your doctor about other alternatives. So if it isn't working for you and you are doing everything right, methadone um, might be something that can work for you. Because some people, just depending, body chemistry is different. It's the preferred med. But I will tell you, you will be going to the methadone clinic more often than if you were taking Suboxone. Um, and the last thing I want to say to everyone is don't feel judged if that is what you need to do and what works for you. I've told everyone this. I am somebody who advocates being a nurse. I have to. I advocate for, if let's say you're abusing anything, heroin, any hard street drugs, PCP, any of that stuff, if you can find an alternative that is safe and effective for you that you've discussed with your doctor and they feel that's the right route, obviously do your own research, and that's what the intentions of these videos are. But don't feel judged if you have to take a medication or whatnot. When I was younger, or even like 3 to 4 years ago, before starting working in the nursing field, I was always, all pharmaceuticals are bad, blah 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 blah. But they can be bad for some people in certain situations, but they also can be lifesavers for you. Medications and holistic / natural substances are a route to go. As long as it is leading to you having a productive and happy life where you can help and influence others, that's what matters. So yeah, that is the Suboxone. What to know, facts to know about Suboxone. If you're gonna start the medication or you're thinking about talking to your doctor about it, obviously discuss anything you have. Don't go off my video. I told you. Always discuss with your doctor. So if there are pieces of this that I didn't talk to you about that you didn't understand, I can leave the link below where I got my information from, which I believe is the best. Gives a thorough summary of the medication from what I've seen. I've looked at a lot of sites, and this is the best. Or and do your own research as well. But find something that works for you. Discuss with your doctor what you think the best approach will be, because they'll listen to you as well. If you have questions about it or you don't want to, that's what they're there for. They're supposed to advocate for you and help lead you in the right direction. That's what my job. I have to be an advocate. I've got to be an advocate for my patients as well, and what helps them makes me happy. Once again, if you can, if you like the video, like it, and I'm going to be doing once again videos. Right now, since I'm currently in between, I'm looking into a new job, I'm interviewing and whatnot. Cut my hair, you can't tell, used to be longer if you look back at some of the videos. I got a haircut. I'm going to be posting a video in regards to something mental health, so it could be anxiety, depression, a mental health disorder, I'm going to do some videos, a playlist on medications, common medications that people have questions about in mental health, drug addiction medications, and lastly, as well, I'm going to be doing, I'll continue my channel and my own personal experiences with drug addiction, because I still am currently, I consider myself, even though I'm not using what I was, I still consider myself an addict in recovery. I always will, because that's what keeps me grounded. That's why I make this channel, because this kind of stuff really helps me. And that's why I really do appreciate if you comment in there and leave what you can, because that's it. The engagement really helps me in these times as well, because I have rough days in general, just like anyone else. But I will tell you this, whatever you are or were abusing, you can beat it. you can. I've seen multiple people do it. I've seen multiple people not try, and unfortunately they passed away, which is sad. Addiction took over. But I really, I just kind of felt like I had a calling to start this channel, because if I can just save one life out there, that's what matters to me. That's really what matters. It helps keep me clean, and we need to be discussing the stigmas of mental health way more, because right now I know they're talking about the COVID pandemic, which is very, very, it's horrible, but we also are in a huge an overdose drug pandemic as well, and we have been, and it's not discussed near as much as it should be. Once again, everyone, I love you all. You got this. It does get easier. Everyone has bad days. That's part of being a human. We have that. We have emotions where we get, we're sad, we're happy. That's part of being a human. That's a lot of times why people use drugs, to not feel those feelings anymore. And let me tell you, when you start feeling your feelings again, and once you've got some clean time and you keep moving, it gets easier and you feel a lot better. Physically, I feel so much better. Once again, I love you all. Have a great night. Kick ass. You are who you are, and you are loved. Peace out, y'all.